It's the new face of primary health care, and the federal government's banking on it having a big impact on hospital waiting times. The Health Minister has released a suite of initiatives to direct people towards their local GP, rather than hospital emergency departments.
It's the post-Christmas rush at emergency departments across the country, with many GPs away for the holidays. The federal government hopes its new health reforms will help cut hospital queues.
I'm here today talking about how the government's investing $260 million to make it easier for Australians to get the healthcare they need, when they need it, where they need it.
It's being sold as a new package, but the AMA isn't so sure.
We're trying to work out what's new and what's not.
The federal government says what's new are the individual plans to improve services.
In some communities, we're seeing mobile GP services. We're seeing GPs going out visiting people, making low-cost home visits in areas like Mount Druitt.
There's also new money. 63 GP clinics around Australia will each get $100,000 grants to support existing after-hours clinics. A popular medical hotline will also be extended, allowing doctors to treat people over the phone.
We've taken 75,000 calls across Australia. 10% of our calls would go through to the hospital, and the remainder we can either treat at home or get them to see their local GP.
And it does mean that some people won't be presenting at emergency departments when they don't need to.
With tough new national goals to see 90% of emergency patients treated within 4 hours, the AMA says much more will be needed.
What we need in hospitals is not these sort of solutions. We need new beds, more efficiency in the hospital sector.
Whether the initiatives are effective remains to be seen, but experts are urging the government to invest in a full evaluation so successful policies can be continued and failed ones cut. Letitia Lemke, ABC News, Sydney.